Everyone knows what Botox does for smoothing out deep lines and wrinkles for the face. But now Dr. Ali Elahi of Mission Hospital in Mission Viejo is successfully using Botox to reduce the pain of migraine headaches.
So there's this growing evidence that botulinum toxin works well in the treatment of migraines. Remember, migraines affect 28 million people in America. Overall, 45 million people suffer from headaches. 28 million people suffer from migraines in particular. That's 18% of women, 7% of men, at a cost of about $13 billion in lost productivity, missed work. The cost of $2 billion in ER visits, $10 billion in medications. Botulinum toxin reduces the release of neurotransmitters that regulate pain in the brain. So in the brain, nerves communicate to each other and to muscles through the release of chemicals called neurotransmitters. Botulinum toxin stops the docking of these chemicals and the release of these chemicals. That's how it paralyzes small muscle fibers. But it also reduces the release of chemicals that conduct pain. Botulinum toxin is not for everybody. It's really designed for people who are tired and have adverse effects to medications they use for migraines. They're developing either tolerance to the medications, or actually they're developing what we call rebound headaches, more headaches from the chronic use of medications. You know, botulinum toxin is an office procedure. It is extremely safe, and it is done very quickly in a span of 20 minutes. What we do is the same technique that the cosmetic surgeons or dermatologists use for injection of botulinum toxin for wrinkles. We dilute the botulinum toxin in saline, preservative-free saline, and we use a very thin needle to inject in specific muscles of the scalp. It's a very simple intramuscular injection. From personal experience, 70% of people that I've injected have shown a good response, and the response they've told me is, quote unquote, "this works." What did they mean? They meant that I did not have to use my medications as often. There was about a 50% reduction in the severity and the number of times I have headaches in a month. For example, if I had 16 headaches in a month, it was now maybe 4 or 5. If my headache severity was 9 out of 10, when it comes now it's about maybe a 6 or 7 at the most. I didn't have to go to the drugstore to buy as many pills. I didn't have to use these preventative medicine that can cause a lot of these side effects. And that's generally the response. The response, remember, is over time, over a 6-month period, not necessarily immediately, although there are some rare people who feel a response within a couple weeks.